So today in the morning, we're going to talk about tips and tricks for lifelike posterior composites. Now, as you all know, we are offering one free CE credit for this presentation today, and I'll show you exactly how you go about claiming your CE credits. I want to thank also our sponsors that have been with us during this entire year. As many of you know, this will be our last presentation for the year, but we have done multiple presentations, free presentations throughout the year. So I do want to thank Colteen, Oral Arts, Comet, and Be in Air for their continued support throughout this 2020 with all of our webinars and being able to allow us to do this for free for many of you. So keep them always in mind, please. The other thing that I want to share with you is the way that you will claim your CE credits. As you know, we always encourage you to visit our webpage, romerodentalseminars.com. When you get into our webpage, you will have this link that says webinars. And in that link, you will find these other three additional links. The first link is our live webinar links where you can sign up for future webinars, and you will see some of these webinars showing up soon. We're going to be fabricating the list for next year for 2021. So please always visit the live webinars link in our site so that you can have information related to our new courses, our new webinars for this coming year. The second link that you have is our on-demand link. And there you will find all our recordings. So you will find links to all our recordings. There's another way that you can have access to our on-demand webinars and you can just visit our YouTube channel, which is Romero Dental Seminars as well. And all our webinars are uploaded into our YouTube channel, and you are more than welcome to watch them and rewatch them. And if you ever have any questions, you know that you can always contact us at romerodentalseminars@gmail.com. And finally, there is another link, the final link, the third link is the CE quizzes. And if you visit that link, when you click there today after this presentation, you will find a link that says Lifelike Posterior Composites. And that PDF file you will download. You will include all your information. Please make your information legible and just answer the questions and submit that to our email, romerodentalseminars@gmail.com. And we will go from there, submitting your CE credits to the AGD or the Academy of General Dentistry. If you are not a member of the Academy of General Dentistry, you will still get a verification form that you can submit to the American Dental Association for your CE credits. One more thing that I do want to remind everybody here is that to follow us on all our social media platforms. We are very active in these social media platforms, and there's a good reason for it. We want to share information. I think that we share valuable information, clinically relevant information in all our sites, and obviously we use these social media platforms to share with you information regarding any upcoming courses that we will be offering. So please follow us on all our social media. And one more thing that you can do when you follow us, this year we started with our giveaway offerings, and we've done two this year. You can see there we've already given both of these kits away. One was from Cable Curry, Sonic Fill 3 full kit, and the second one was a Brilliant Everglow startup kit as well. They have both been shipped. There you can see our first winner. We're just waiting for our second winner to receive his kit and be able to share with us his photo. But again, if you follow us on our Instagram account, you will be able to participate on these giveaways that we do them 2 to 3 times a year. And hopefully you can become one of our future winners. And there's nothing that you need to do, just to follow us and share our Instagram page with others. So thank you if you've already done. And if you haven't done so, please go ahead and follow us on Instagram. So let's get started with our tip and trick number 1. And our tip and trick number 1, I'm going to share with you this concept called the Cusp buildup technique. And I'm sorry I'm missing a D right here, but I will edit that at the end of my presentation. We call it the successive Cusp buildup technique. And this is going to be a very clinical webinar. So I'm going to share with you a lot of clinical cases with a lot of, I believe, very valuable clinical information. And I want to remind everybody today that we are talking about lifelike posterior composites. So what we're trying to achieve today is to restore posterior teeth to a lifelike appearance. So we're going to make them look as real as we can, as natural as we can. That is our goal today. And I'm going to share with you some tips and tricks on how we go about working on that. So on the left-hand side, you can see what's going on with this patient. She had an amalgam restoration and a composite restoration on both of these premolars. The composite restoration, you can see, had already some staining, very flat, very little anatomy left. The amalgam, you can see a little bit of fracture on the margin. So, very old restoration. They were both ready to be removed and replaced. So that's what we did. We went ahead and we removed both restorations. And I want to put your I want you to pay attention to this composite right here on the second premolar, because this is what normally I find or I see when I get patients that come to me and require either other treatments or for me to just go ahead and restore an occlusal or a restoration on a posterior tooth. So the idea that I want to share with you here is that we all learn in dental school the horizontal layering technique to restore posterior teeth. And one of the things that I do not like about this technique is that you always end up having these flat restorations. They really don't have any anatomy. You adapt them well to the tooth. They do adapt well to the tooth, but I don't see them functioning very well because they really don't have any tooth form or tooth shape. And the reason why they don't have it is because we're just placing 2 to 3 horizontal layers. We're making a flat restoration from the beginning. So the successive cusp buildup technique is a technique where we are going to change our mentality and we're going to go from that horizontal layering technique to a combination of a horizontal and oblique layering technique so that we can build our occlusal anatomy from the get-go. So from when we get started. So in this particular case, and again, we've spoken a lot about this throughout the year about different bonding techniques. So we have a webinar only on bonding agents that I would highly recommend that you watch if you haven't done so. But here we decided for good reasons to do a total edge technique. So you can see we're creating we're removing all the smear layer. We're creating the right environment on the enamel. We etch the enamel for 10 to 15 seconds, no more than 10 seconds, the dentin, and then we rinse thoroughly. We do not bone dry. We allow that dentin to be slightly moist, and then we're going to go ahead and we apply our adhesive. In this particular case, we're going to use a universal single bottle dental adhesive, and we're going to saturate our preparations with the adhesive. Once you've saturated the dentin with the adhesive, you want to remove the excess of the dental adhesive. And I normally recommend removing the excess of the adhesive using a brand new micro brush. So with a brand new micro brush, you get into your preparation, you absorb some of the excess, and then you go ahead and you can dry it on a napkin or on the patient's bib, and then you go back in 2 to 3 times until you get a nice and even layer thickness around your entire preparation. Once you have achieved that, I always recommend using a gentle stream of air, 5 to 10 seconds, to eliminate the solvent that normally is part of our dental adhesive, and then you go ahead and light cure. So once you light cure, we're ready to restore. And this is where the concept of successive cusp buildup technique starts. And there's a couple of ways that you can go about this. As you can see, both of these preparations were really not that deep. But even though they were not that deep, I want to make sure that I don't have any voids between the first layer and the dentin layer, the superficial dentin that is on the bottom of my preparation. So that's the reason why you normally want to start your successive cusp buildup technique with a horizontal layer. In this particular case, because my preparation was not deep, it wasn't very deep, I knew that I only needed one horizontal layer. Keep in mind that when you're using regular microhybrid composites or nanohybrid composites, you want your layer thickness to be 2 millimeters or less. So always, you can use a probe to kind of measure. You can use your eyes to kind of visually estimate, okay, how deep is this preparation? But try to stay in that range of no more than 2 millimeters for your increments. Now, what you're seeing here is that I am using, and I'm actually applying, I'm sharing with you the shade that I'm using. I normally use, I would say 8 out of 10 times, I'm going to use an A4 dentin, a very saturated dentin shade for my first horizontal layer. And the reason why I do that, again, we're talking about lifelike restorations. And we all know that the dentin is more saturated, has more color, more yellow to it compared to the enamel. So what I want to try to do with using A4 composite is I want to try to mimic that dentin shade. I want to try to mimic that yellowish dentin shade so that I can create some depth in my restoration. Meaning that when you see through my A1 that I'm going to use for the cusp inclines, you will get some of that yellow coming out through that A1 shade. So my first layer is going to be an A4. You can see I have condensed both of these horizontal layers. And the other thing that I want you to pay close attention to is that I am not at the cable surface margin. I'm actually below the cable surface margin. So I want to make sure that my dentin thickness, my A4 shade thickness is always below that cable surface margin, so that I'm now aware and I can visually assess that there's room for my successive layers, which are going to be my oblique layers. So once you place your horizontal layer, you condense it very nicely, you smooth that layer, you go ahead and you light cure. Once you light cure, then we go to the next step, and you can see it on the right hand side. And what I'm going to do now is I'm going to build every cusp individually. And I'm starting with this small tooth because it's easier for me to get you, kind of explain this technique for you by looking at a small tooth. But I'm going to share with you all kinds of clinical situations today. So you can see here, I am building now my buccal cusp, and I am, very little amount of composite. I am literally using a thin cord packer and an explorer to get, you can see that I've, bonded this to the buccal cusp, and I'm creating a little bit of secondary and tertiary anatomy here with my explorer. I make sure that that blends in nice, and you don't see any transition line between the composite and the actual enamel. And I'm using an A1 shade. Again, this combination is one that I use 80% of the times. I'm not really selecting a shade for posterior teeth. I'm just combining A4 and A1. I would say 20% of the times, if my patient's teeth are very, very yellow, I may combine A4 and A2, but those are normally the combinations that I use to get these type of results. So here you can see I've done the same on both of the premolars. I've only created an oblique layer for my buccal cusp. And now I'm going to go to the next slide. And before I start adding my lingual cusp, I'm going to add a little bit of a tint. And this tint, again, you can see I use either gold or ochre, depending on the brand that you buy. I normally use one made by Coltine, and Coltine has one that is called gold. And this is what you're seeing right here. You can see that little gold color that this stain has, and I apply just a little bit in the center, in the areas where I'm going to create my pits to create a well-defined occlusal anatomy on my restorations. Again, I apply it before I do my final lingual increment so that I can hide a little bit of the yellow. You really don't want to use a whole bunch of this tint because, believe it or not, it shows through a lot. But I like using it. I like recreating nature. I like trying to make my teeth look real, and real teeth are not white A1, B1. Real teeth have a lot of color in them, have a lot of stains in them. Most importantly, posterior teeth. So I want to try to rebuild that for my patients. And there you can see I've added a little bit of the gold. And now I'm going to go ahead, and once I've added my color intensifier, I'm going to go ahead and I'm going to do my second buildup, successive buildup or cusp buildup, which is going to be, in this case, the lingual cusp. So now I have both the buccal and the lingual inclines been restored with composite. And if you look at these restorations, you can we can just summarize this saying we have one horizontal layer, one buccal incline, one lingual incline, and a little bit of stain applied in between these inclines in order for me to get this color depth that you can see on these photos. Once I do that, I go ahead and I remove the rubber dam. I now adjust the occlusion. When you build teeth using these techniques, you will notice that your occlusal adjustment is going to be a lot less. Because think again, if you were to place two horizontal layers, you're going to end up with a flat restoration, and it's going to be an over contour restoration right in the central fossa. With this technique, you're actually building your central fossa from the get-go. So there's very little, not only that there is very little for you to do when it comes to occlusal adjustment, but most importantly is there's a lot there's less need for you to use multiple burrs in order for you to get this anatomy. I literally created this anatomy with an Explorer, so there's really no need for me to have any special burrs to get in here and recreate nature, because I did it from the get-go. I did it starting out with my successive Cusp buildup technique. And that technique, and I'm going to share here with you another case, that technique, what it enables you to do is that you're building each portion of the tooth individually, so that you can now, when you finish your restoration, you have something that looks more like a tooth and not something that is completely flat, that obviously is going to require more adjustment on your side, because the teeth, the opposing tooth normally have cusp, and these cusps have to sit somewhere. And normally where they sit is that they're going to sit in this central fossa. So make sure that you understand that concept behind this technique, so that we now know why we are using, or why we recommend using this technique. Now, this is my second case with you. You can see a little bit more of a larger restoration. Now we have the lingual aspect of this molar as well compromised. So we're going to go ahead. We're going to remove the decay. We remove the amalgam. We remove the decay, and we go about acid etching. Again, we're using, in this particular case, a total etch technique. There's enough dentin covering that pulp. There's nothing that we need to be careful with. So we're going to use a total etch technique. We're going to rinse the acid. We're going to leave the cavity slightly moist. And there, in this particular case, we use a 2-bottle adhesive system. So we're using a 4th generation dental adhesive system that has a primer in one bottle and the adhesive in another bottle. And that's what we're going to use for this particular case. You can see now we've created a hybrid layer by combining the primer and the adhesive. Again, we follow the same technique. We eliminate the solvent. We eliminate the excess with a microbrush. We light cure, and then we start layering. In this particular case, I'm going to do 1 horizontal layer on the bottom, and then I'm going to do 2 or 3 oblique layers on the occlusal aspect. Same thing here on the distal lingual groove. We're going to do only oblique layers, and you can see one on this side of the tooth, the more mesial aspect of the preparation, and one on the more distal aspect of the preparation, or lingual aspect of the preparation. We do 2 oblique layers so that we can recreate a little groove in this layer. So again, we're thinking about how do we layer composite so that we can get the occlusal anatomy from the start without us having to then need to use a burr towards the end of my restoration. And again, you can see the restoration has been completed. We've completed the occlusal. We've completed the lingual. I have a little bit more to go here on this aspect, on the lingual aspect. You can see it already restored on this photo. But look at the final anatomy without me using any burrs. If we look at this together, you can see that I've created enough chroma. I've created enough depth of my pit and fissure systems. I've created the ideal anatomical form of the tooth. So I'm trying to reproduce nature just by using this successive cusp buildup technique or concepts, with the idea that at the end of my restoration, when I have to now adjust the occlusion, if you look at my completed restoration on the previous photo, and then you look at my finally polished and occlusally adjusted restoration, there's very little difference, because again, my adjustment is going to be minimal. And that's one of the things that I like about this technique. It may take you a little bit longer at the beginning only to get used to the technique, but when you get to the finishing aspect of your restoration, when you get to the finishing and polishing, it's going to be so much faster and easier, because you have now a restoration that looks more like a tooth than having just flat horizontal layers applied to your occlusal surface. So with that, we complete our first tip and trick, and now we're going to go to our tip and trick number 2, which is the occlusal analysis. And again, all these things are very, very important. They all are part of one big technique in order for you to get ideal lifelike posterior composite restorations. But I'm separating them just to make my point, my educational point, and a good understanding of how this technique goes about. So I'm sharing with you this case and this composite. was placed in this patient by a different provider, maybe a year before I saw this patient. And when I look at composites a year after they've been placed, and you see this amount of wear, you have to start thinking about, okay, what's happening with this restorative material, what's happening with this restoration that is having so much wear on this posterior tooth. And again, look how flat the restoration appears to be. You can see that maybe when they completed, I'm just guessing, maybe when they completed this restoration, they ended up with a very flat restoration, and then they started adjusting the occlusion, and now suddenly they just removed a whole bunch of composite from the center or the central fossa area of this tooth. Now look at the neighboring tooth. Again, a flat restoration, and this is something that I normally see when you see these flat restorations. You have something that is called a stress buildup, and I'll talk a little bit about that in a couple of minutes. But just to give you an idea, when you're light curing your restoration, you're going to have some stress building up in that during that polymerization phase, and that stress can affect negatively your restoration. So I see that a lot when you do horizontal horizontal layering techniques. So the other thing that I want to mention here is the occlusal analysis. When you have large restorations like this, yes, you want to make sure that you do your successive cusp buildup technique. You may want to combine it with a centripetal technique. That is another concept that I'm going to share with you today and at this moment. But the most important thing is that you have to ask yourself, where are the occlusal contacts? Where is this tooth? Where are the occlusal contacts on this particular tooth? Because I want to make sure that my composite and the tooth structure, they both interact correctly and they have occlusal contacts. I want to try to stay away as much as I can from the margins of my restoration. I don't want any occlusal contacts in between the margins of the tooth or the interface between the restoration and the tooth, because those are weak areas of my restoration. And if I maintain contacts there, most likely you're going to get this chipping and fracturing of your restoration fairly soon. So what you're seeing here, you can see that they had an initial contact in this area. You can see that the composite is still contacting some here, but because there was a contact here, this composite fractured here. Same as you are seeing here on the lingual side. You can see that there's still some contact here on the tooth, some contact on the composite right in the interface. You can see the fracture right here in this area. So this is something that I commonly see. But the other thing that catches my attention is that not only I have contacts in these interfaces, because sometimes we have to realize that you're going to end up with contacts in those areas because of the size or the way of the of your preparation. But look at the lack of contact or occlusal contacts in the central fossa area. So what that means is that all the load on this particular restoration is being held by all these margins and none being dissipated on the central fossa of the composite, where you have a block of composite, where you have a thick layer of composite. So that's the strongest area of your composite restoration. So please keep that in mind. And what I would recommend always is that before you go ahead and restore a tooth, if you have a large amalgam or if you have an old or existing composite that is failing for whatever reason, grab some articulating paper. Have the patient tap on the articulating paper and look at where the occlusal marks are. And then design your preparation and kind of visualize your restoration based out of what you're seeing in that occlusal analysis. And we all learned how to do this in dental school. We just, get into that pace of working every day in and out, that we think that we can overlook these things. And when we overlook them, you have these issues. So, please keep that in mind. So again, what we're going to do is that we're going to build this composite based out of that stress-reduced direct composite restoration concept developed by Deliperi and published in the literature. And what it really is more of a layering technique that reduces the amount of stress that is built up on the composite while you're polymerizing. So that is why we want to combine, for cases like this, large class 2s, we want to combine a centripetal and a successive cusp buildup technique. These both of these concepts are going to help you reduce the amount of stress that is built upon your composite, within your composite, while you are polymerizing. But the other aspect that you want to keep in mind as well is that you will reduce the amount of stress that is built up on your composite occlusally. So if you have a good occlusal analysis and you end up with a good with a stable occlusion on your restoration is going to suffer a lot less too. Now, that being said, we all know that these materials wear, but they have and the larger the restoration, the faster these materials are going to wear. So we're not going to be able to escape that. They are going to wear, but what we want is that to have that wear at the slowest rate possible. That is our ultimate goal. Now, you can see here I have removed completely the previous restoration. You can see that this was a very, very deep preparation. So at this moment, I have to think about, okay, I'm working in deep dentin. So the beauty of this is that I have a lot of enamel, and I know that bonding to that enamel is going to be great, but I have deep dentin, and that deep dentin, if I got to make sure that I understand that I have to adhere to that dentin in a special way. And there's a couple of things that you can do. One of the things that I like doing is using a liner, because we all know that using a resin modified glass ionomer liner, like for example, Vitribond or Ultra Blend, all these different type of liners, you can apply on the dentin and you are going to get immediate seal of that dentin. So now if I go ahead and acid etch, do a total etch technique, my deep dentin is protected. Or I can decide and use a selective etch technique, but I'm still having this sealing of the dentin protecting so that I don't get any monomers going through those deep dentinotubules into the pulp and creating some type of pulpal reaction. So that's something, again, that we spoke about in our adhesive webinar. So go ahead and review that one if you feel that it's something that you may want to review. But we're going to start now with our centripetal technique. And what the centripetal technique states is that what we want to do, we want to build the missing walls first. So if you have an MOD preparation, you're going to build your mesial wall and your distal wall first. In this particular case, we're missing the entire buccal wall and part of the distal wall. The first thing that we're going to do is build that distal buccal walls that are missing. And you can see here, I have added composite to try to build the distal and distal buccal aspect of this tooth. And then I'm going to do my second layer to build now to close that buccal wall and create that ring around this tooth. So now what I have done is I have transformed this class 2 preparation into a class 1 restoration, because now I have a buccal wall that I don't have to worry about. This buccal wall, this enamel or dentin layer of composite is so thin that the light is going to go through and through. It has very little amount of adhesive or bonded walls, which means that you're going to have a lot of surface within that composite to free any stress buildup that is happening while you are polymerizing. So this helps you reduce that polymerization shrinkage that we know occurs every time you polymerize a composite, and that you cannot control effectively using a horizontal technique, because you just have too much composite and too many adhesive or bonded walls, or walls that you need to bond to. So now once we have encircled this restoration, now all we have to do is think about that class 1. And what we do there, again, one horizontal layer, 1 to 2 millimeters thick, and then we start building each cusp individually. So if you look at this here, this is immediately after I have completed just building the composite using an Explorer and using a core packer. So I'm just going in, creating with my Explorer the central fossa, the buccal and lingual grooves, my mesial marginal ridges, everything, all the details that I want to recreate. I try to do the best I can using my Explorer. And then I just go ahead, remove my rubber dam, start my finishing and polishing, remove any excess, do my final contours. And you can see how natural the occlusal anatomy, we were able to achieve such a natural occlusal anatomy with very, very little effort and very, very little rotary instruments being used. Again, occlusal adjustment is simplified using this technique. Now, that being said, at the beginning, if you've never done this technique before, yes, it's going to be a little bit, it's like everything in dentistry. We train, we learn, we get used to things, and then we just, it just becomes second nature. For me now, it's second nature because I've been doing this for a long time. And this is the only way I restore posterior teeth, using these techniques. But, again, it may take you a little bit more at the beginning, but it's going to reduce the amount of time that you spend, just working and trying to get this tooth to look like a tooth if you use horizontal layering techniques. Now, I want you to look at the difference here between my restoration and the existing restoration on the second molar. As you can see, this horizontal composite technique, layering technique that was used to restore this second molar has no effect on the occlusion of the patient. The patient is not even touching that area. Of course, because if I place a horizontal layer and it's thick enough, the patient is going to hit on it. So what do I have to do later? I have to grab a burr and reduce it so that he can feel like it's not in hyper contact. But what do I end up doing? Look at all the areas of the tooth, lingual cusp and buccal cusp that are in contact, inclines that are in contact that shouldn't be in contact. So I am altering and modifying the way that this tooth comes into occlusion. Look at my restoration. I have the buccal cusp, I have the central fossa. So I have incorporated my restoration, my composite, into this occlusal system so that it is part of it. And I don't worry about wear. I know that I'm going to get wear. I know this composite is not going to last forever. Like nothing in the patient's mouth will last forever. But I know that it's going to behave properly because I have been able to share the load between the composite and the tooth in a way that the load is evenly distributed. And I tried as much as I could to have no occlusal implications or no occlusal contacts in the areas in my margin area. So in the interface between the composite and the actual tooth structure. And this is after I think 15 or 30 days later. You see highly polished. I was just checking on the patient, making sure that there was no hypersensitivity and the patient had no sensitivity. This is the occlusal view of the completed restoration, and this is the buccal view, and you can see the very nice transition between the composite and the actual tooth structure. So very nice and uniform. And again, we all know composites are really good restorative materials, so nothing to say about that. But again, it's just about thinking about the technique. So my tip and trick number 3 is going to be talking about essential lines. And again, we're just trying to put all these concepts together to try to teach you and share with you the information needed in order for you to be able to develop these restorative technique or these restorative strategies. So what the essential lines are all about is us understanding and looking at the anatomy of natural posterior teeth. Because when you have a picture in your mind, you have a picture of this anatomy, what you have to do every time that you are building using either a centripetal a successful cusp buildup or a combination of a centripetal and a successful cusp buildup technique, every time you do that, I want you to think about this anatomy. I want you to picture yourself, these first molars, the second molars, the premolars, all the different anatomies that we have and that we learned in dental school that we know very, very well. Because if you picture this anatomy, what you have to try to do is develop a technique, a layering technique that will get you to this anatomy at the end of your restoration with the least amount of effort. And again, we're just looking at the way that first molars are and second molars are designed. You can see the 3 cusps here on the buccal side, and you can just look at the fissure system and the way that the fissure system helps create or recreate this normal occlusal anatomy for that first mandibular molar. Same thing happens with the premolars. The first premolar and the second premolar, they have differences, different anatomical features. And again, if you learn them by heart and you keep them in mind, all you have to do is try to reproduce this within your layering technique. And that's really what we're talking about today. We're talking about, okay, I understand the anatomy of the first mandibular premolar, the second mandibular premolar, the different types of premolars that we have in the mandible, the H type, the U type, the Y type, so that we know, okay, which one is the one that I'm going to select to reproduce that in this particular tooth. If it's an occlusal restoration, well, the occlusal anatomy should give you exactly what you need to do. If it's a more complex type of restoration where you need to replace cusp, well, now you can become creative. Look at what the patient has on the other premolars and try to reproduce those based out of the current anatomy that they are presenting. So I'm going to walk you through some of the cases maybe a couple of cases where I'm using these concepts of essential lines, which again is no other than the actual occlusal anatomy that we learned when we were in dental school, and applying those concepts to my layering techniques so that my end result looks like those essential lines. And again, I have here a mandibular premolar that I'm going to go ahead and restore. You can see that it's kind of like it has a little distal lingual cusp and a mesial lingual cusp. So there's a little groove here. I immediately know that this is probably going to be like a Y-shaped type of premolar. So again, preparation is very, very small, but fairly deep. Most likely I'm going to, it's deep, but it's not deep enough for me to have to consider anything special on the dentin. So I'm going to go ahead and acid edge. I'm going to do a total edge technique, rinse, leave the dentin moist, prime and bond, light cure the prime and bond, and then go about restoring. You can see that I've already placed my first layer of A4, my first horizontal layer. I'm now working on my successive cusp buildup technique, and I'm starting on this mesial lingual cusp. You can see that I'm trying to stay away from the distal lingual so that I can recreate this little groove that should go in between these two cusps. So I'm going right here. You can see I have my distal lingual. Now I'm doing my buccal cusp. And you can see that when both of these cusps, these both increments, these successive cusp buildup increments come together, I am recreating here a groove. So I'm doing my fissure system, everything from the get-go. I'm not leaving anything for burrs to be done. I'm gonna do this with my Explorer and with my cord packer instrument, a very small cord packing instrument, and my Explorer. I have two increments here. Now I'm gonna go ahead and I'm gonna add my third increment. And you can see with this third increment, I'm trying to rebuild this cusp. And here you can see the groove that I'm leaving. You can see now I'm trying to achieve that Y shape that I initially had planned. So I'm going to just go in and just start adding my composite little by little, very small increments. But I'm just trying to be very careful and very selective of the way that I do these layers so that I can end up having something that looks like a tooth. I'm going to now have a little pit here. I'm going to stain that pit. What you're seeing here is glycerin. I'm using a glycerin layer to do my final curing of this restoration. This will eliminate any oxygen in the area so that it will increase the potential of polymerization of my composite for sure. And then you can see the pit system, the pit and the groove that we were able to stain. And this is now the final occlusal adjustment. We adjust here, we eliminate any of the contacts, and we are done with this restoration. And again, you can see the Y shape that we were able to recreate following the concepts of essential lines. You can see the before and after. We were just trying to mimic, there are the essential lines, and we are trying to use these lines with all the other concepts that I shared with you in order for us to be able to reproduce nature. And again, you can see, depending on the tooth that you're going to restore, we're going to now restore a mandibular first molar. We're going to use the same technique, essential lines. We're going to remove the previously placed composite restoration. You can see this is a horizontal technique, and this is a very common technique. But I want you to look at the anatomy. There is no shape. This doesn't look like a tooth. This is just a flat surface, a flat layer of composite placed on that occlusal surface that at this point you can see the amount of wear that the restoration has. And this is typically the case in a short period of time. When you do a build-up technique like the ones that we're sharing with you, you will notice that your composite, if the occlusion is adjusted well and you've looked at the occlusal analysis and you looked at all that, you will see that your restorations will last longer because anatomically they're better structured. So here we go. We remove. There's some decay left behind, so we're going to go ahead and clean that area. Any deep areas that we find, we're going to go ahead and place our liner. In this particular case, we use Vitribond from 3M. So we're applying our liner here. Now we're going to place our band. And again, we're going to start building the proximal wall. Then we're going to do our horizontal layer. And then we're going to start doing one cusp at a time. And here we go. This is now, we've done our proximal wall. We've done our horizontal dentin layer. Now we've built up each of the cusps one by one. You can see it right here using the Explorer and the chord packer. And what we're trying to do, again, our essential lines, we recreated those essential lines in our occlusal anatomy, and we build up the tooth. We build each increment ahead of time, thinking about these essential lines so that we get the right occlusal anatomy in our final restorations. And again, we do this every time, thinking about this. We have a picture, a visual picture in our mind every time we're restoring teeth, and we're thinking about occlusal anatomy that we all know very, very well. And again, this is now a mandibular first molar. I'm sorry, a maxillary first molar, and you can see a little bit of deep caries dentin there. We're going to go ahead and remove that, and then we're going to place a liner. We're going to use Vitribond again. We're going to place, in this case, a Toffelmeyer band. We're going to start building. We haven't built our distal wall here. We're building our cusp. This is not a very deep preparation, so there is no horizontal layer. We're now going to build our distal wall, and then we're going to put every single increment. And you can see one cusp at a time. The distal lingual, the mesial lingual, the mesial buccal, and the distal buccal. And all these cusps come together and form our central fossa and our distal lingual groove. So again, we're adding the tint. We add our final layer. You can see we have gone in with a very sharp explorer. And the explorers that I use for this type of occlusal anatomy, I only use for this. I don't use these explorers. I have a set of explorers only for operative dentistry that I use to restore teeth. I don't combine or mix those with the ones that I use to do exams on my patients. I want very sharp and really good quality explorers so that I can get in here and just develop that anatomy with a very fine instrument. And again, you can see the first molar after completion of the restoration, and look at the essential lines. Again, we're just trying to mimic nature using these concepts. My final tip and trick for today is going to be implant access holes. And the reason why I add this here is because we all know that when we restore implants, we normally have to seal that access. If it's a screw retained type of prosthesis, we are going to have to seal that access using a resin composite. And again, I'm going to now use the same concepts that I have shared with you today on natural teeth. I'm going to use the same concepts for the access holes on my implant restorations. And these are screw retained, screwmentable type of restorations, meaning that I have a custom abutment. I have an individual crown that was cemented extraorally with an access hole on the occlusal surface of the crown. You can see that I asked the lab technician to add a little bit of color tint to my restorations to give it a more of a lifelike appearance. So now what I'm going to do is what we all do. We try in the crowns, we sit them, we adjust the occlusion, we highly polish them. Now I have these access holes to restore. And, I like, whenever I can, I like to restore these access holes to the, to a natural looking restorations, because I know we have the materials today to do so. So what I want to share with you is the way that I do this, and just using the same concepts and techniques that I just shared with you. The only difference that I do that I have here is that the type of composite that we're going to use. We want to use a very opaque composite. So we want to use a dentin-like composite, if at all, a universal opaque dentin, so that we can hide that gray appearance of the metal. So the first thing that we're going to do is that once we have isolated this area and I'm ready to restore this, and this is exactly the day of delivery of these restorations, I'm going to go ahead and, as we all know, we're going to place our Teflon tape so that we don't have any composite getting into the screw, so that we can remove these restorations if we ever need to, right? So we go ahead, we place these Teflon tapes, and then right on top of this Teflon tape, these are zirconia crowns. So what I'm going to do now is I'm going to create a good bonding surface for the zirconia crown. How do I do that? I do that by adding a primer, a zirconia primer, to the restoration. The one that I like in particular is one made by Dentsply, and it's called Monobond Plus. And the reason why I like Monobond Plus is because Monobond Plus is a trifunctional monomer, which means that is you can prime metal, etchable ceramics, and non-etchable ceramics with this primer. So by doing that, I apply the primer, I leave the primer in contact with the zirconia for 60 seconds or 1 minute, and then I'm ready to now uh, add my adhesive layer. So I'm going to now bond, I'm going to use an adhesive to bond to that zirconia. So this is going to improve the bonding capabilities of my resin to this zirconia restoration. Is it going to be a perfect bonding? No, but it's going to be a much better bonding compared to not doing anything to the zirconia. So I'm going to use that primer, and that's the reason why I use it. And this is the same primer that you will use to bond a non-etchable ceramic like zirconia to a substrate like a natural tooth. So I'm going to apply that. I'm going to eliminate the excess. I wait 1 minute, and then I'm going to apply my adhesive. I'm going to lacquer my adhesive, and now I'm going to again use my first layer. I'm going to use an opaque dentin like composite. This particular case was restored with brilliant Everglow, and I'm using the opaque dentin shade, and I try to match the shade of the zirconia. In this particular case, this was A2. So I'm going to go ahead and add an opaque A2. And you can see that in that opaque A2, that is one single layer, I have used my core packer to kind of indent that layer and create some areas for my stains so that I can continue with the natural stains that the lab was able to give these restorations. And you can see I've done the same here on the premolar. Once you do that, I'm going to go ahead and I'm going to add the stain. And once I've added the stain to that little space that I created with my core packer, now I'm going to go ahead and add very small increments, and I'm going to now use in this particular case, because this is a zirconia, I'm going to use a dentin-like type of material. If this was a anterior tooth, or this was Emax restoration, and there's a lot of enamel shade that has been used, then maybe I will use a enamel shade for my final layer. But in this particular case, because this is a zirconia restoration and this is a very opaque material, as we all know, I'm only going to use dentin throughout. So I'm using a little bit more dentin, and I'm creating both the buccal and the lingual inclines. And I did the same over here for the posterior tooth, for the molar. And then I just adjust the occlusion, polish. And this is the final view of both restorations after I've completed my access hole sealing using composite resin. So with that, that is my final slide. I hope that you have enjoyed today's presentation.